gosh, guys, I'm so sorry. I just got in. What happened with the other doctor? They're feeling ill? Okay, yeah, well, I wasn't expecting to be on call, so I'm still in my costume. I'm gonna have to go change. You already put a patient in my room? Oh, hi there. Hi, I'm Dr. Mint. I'm sure you overheard. I'm so sorry to be in such an unprofessional outfit. I wasn't supposed to be on call today, and well, here was something with the other doctor. So I'm going to be looking after you today. So let me take a peek into your file. I wasn't expecting my team to be so quick with getting my patient in the room. So let's see, can I just have you confirm your name and date of birth for me? Good, and can you spell that? Okay. Nice. Okay, and date of birth. Yeah, my sister was actually born that year. Yeah. Twins. You too. Sorry, not really. It's just you're twins. Okay. Please. So, what brings you in today? What seems to be the problem? Okay, you're looking to get a pelvic exam. Okay, well, we can do that. Are you having any problems and noticed any painful urination, blood upon urinating, any pain in that area, in your genitalia? Okay. Good to know. Are you currently sexually active? Okay. And how many partners have you had in the last 3 months? Are they male, female, both? Okay. And during your sexual encounters, are you using protection? So are you using condoms? And are you doing that every time? Let's see, have you had any tattoos recently? Okay. And they were all from, like, reputable businesses, or were they done by, say, just like a stick and poke done by your friend? Okay. Good. And then I do need to know, do you use any drugs at all? Okay. And that would include things like even marijuana. Okay. I just need to know if you're taking anything. Do you use cigarettes or vape? Okay. Got that. And then, do you have any allergies to food and or medication? Okay. Okay. Gotcha. So it looks like the biggest thing you're having is some kind of burning on urination. And now, is this a pretty recent symptom that you've had, or have you had it for a while? Okay. So it started a couple days ago. Okay. Have you noticed any blood in your urine? Okay. Yeah. Have you had a UTI before? Okay. Gotcha. It is less common of a thing that can happen in males, but that doesn't mean that it cannot. So we can definitely check by that from the urine sample. But have you noticed any unusual discharge from your urethra at all? Okay. No other areas of redness, rash, any kind of bumps or pustules? Alright. So I'm going to get your vitals quickly. Put down this. I'm going to check your eyesight real quick, so I'm just going to have you look straight ahead at my nose, and I'm going to shine this bright light into your eyes. Just keep them open as best you can. Thank you. Just make sure that your pupils are able to dilate. Good. And now please watch the light with just your eyes. Just follow the light for me. Okay, good. And eye movement is fluid. And again, just look forward. I'm going to cover one eye. Good. 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 The other side. Good. Okay, perfect. Now I'm going to listen to your heart and lungs. Okay, I'm going to start by listening to your heart real quick, so just breathe normally. Okay, and now I'm going to listen to your lungs, so just take a deep breath for me. And out. Another deep breath. And out. And breathe normally. Good. Okay, come to the other side. Okay, take a deep breath for me. And breathe out. Another deep breath in. Breathe out. And breathe normally. Good. Heart and lungs sound good. This. Back on. So we will move on to getting a urine sample from you. We do have a restroom right over there. So what I'll have you do is grab one of the vials that should be already in there. There'll be a little marker, and the vials have the sticker on it, so you'll just write your name and date of birth on that vial. You'll just fill the sample cup up to the line that's already printed on it, and then just put it on the cubby that's in there. And then I'll have you change into a gown. You'll come back out and we will do the physical examination, okay? Sounds good. I will get my jacket on so I look a little more professional, not in a costume, and then we'll get going once you're ready. Okay, sounds great. More or less, yeah, you can come back out and just stand right there for me. I'm gonna get my hands sanitized and gloved up. So what we are going to do is a physical examination of your penis and testicles. I'm just going to look over them visually, and then we'll do a palpation test just to check if there are any areas of lumps, bumps, things that shouldn't be there, okay? But I suspect that it is a UTI. Are you having any pain in your lower back? So when a UTI progresses, it can become a kidney infection, but it sounds like you've only had this for what? You said a couple days? Yeah. So I don't think it would have progressed that far. You'd also probably have a fever and just be feeling pretty bad. Okay. I left my pen light over there. I'll be right back. One moment. Okay, so I'll just talk you through it a little bit before we get going. When you're ready, I'm just going to have you remove the gown, and I'm going to visually look over your genitalia with my pen light. Again, just looking for any areas of redness, rashes, anything that just shouldn't be there, anything abnormal, okay? Perfect. I will then have you just lift your penis out of the way and then lift your testicles up just so I can see underneath both, and then we'll move on to the physical examination where I will do that palpating like I mentioned before, which is just me taking these top two fingers and my thumb, these just some kind of firm lumps on your body, essentially, like that. And then I'll just have you to let me know if there's any areas that are painful. There shouldn't be. I'm not going to be grabbing very firm at all, but just let me know if there is anything painful. And obviously, while touching a penis, that is an organ that is aroused by touch, obviously. So if you were to ever get an erection during this process, we'll just take a moment, pause, and then get back to it, okay? Awesome. And if you're ever feeling uncomfortable, painful, whatever, just let me know at any time and we can stop. Marvelous. Okay, so I'll just have you remove the gown now. And I'm just going to take a look over your penis. Just see. Everything looks good. And you haven't had any trauma to the area at all? No, like sports injuries, for example? Gotcha. Okay. But nothing recent. Okay, now I'll just have you lift your penis up so I can check the underside. Good. And then we will just look at the scrotum. Tissues look good, healthy. And then again, just lift up your scrotum for me. Thank you. Just take another peek. Okay, tissues all look good. Oh, pardon my stomach. Okay. So, now we're going to move on to the physical portion where I will be palpating you, okay? Alright, so what I'm going to do is, again, take my hands just like I mentioned earlier. I'm going to start at the base of your penis and then palpate down towards the head, okay? Good. So, this will be the pressure. Is that alright? Good. Okay, so let's begin. I'm just going to be feeling for any lumps, bumps, areas of firmness that shouldn't be there. Alright, and then once I reach the head of your penis, I am going to squeeze and lift down your urethra. And it does look a little inflamed, but I'm not seeing any signs of abnormal discharge. And you just said you were having some burning and pain during urination, correct? Okay. Good. Other than that, everything looks okay, so it is definitely leading to my UTI idea. So now I'm going to, oh, this did not catch on, just put them there. Alright, now I'm going to go down the sides of your penis. No pain there? Okay, good. Now we'll just turn your penis out of the way and we'll just do a quick check of your testicles. Feeling, making sure everything feels as it should. And then the other side. Okay. Perfect. Okay, so you can go ahead and put the gown back down. You're done with the examination. So I'm just going to step out, chat with the nurses, and see what the results of your test were, okay? Alright, we have the results of your test back on your urine. And your urine results did show that there was a little bit of blood in your urine. It was so small that I'm sure you didn't notice any blood in your urine, but also a high white blood cell count. So that is going to be indicative of you having a UTI. So what I'm going to do is write you a prescription for a course of antibiotics, okay? Okay, let me grab my book. Alright, let's see. And which pharmacy do you use? Okay. And is that the one that's downtown? Perfect. Okay. Perfect. I have that marked down for you. So what I'm going to do is give you a 7-day course of antibiotics. You are going to take 2 pills a day, and you're going to start right as you go pick them up. So they should be done in roughly an hour, okay? Once I send them off. So you should pick those up and then start them. So you'll take 1 pill today, and then you'll start taking 2 a day tomorrow, okay? Perfect. You're probably going to want to take them with food. They can cause an upset stomach, alright? Okay. Good. Do that. And you're going to want to refrain from drinking any alcohol while you're on these. Okay. Good. I got that all sent off to your pharmacy. So those, again, should be ready in roughly an hour. Do you have any other questions for me? No? Okay, well, it was lovely getting to meet you and treat you. I hope that you start feeling better soon. Just make sure you take your full course of antibiotics, okay? Perfect. And, yep, come back or give us a call if anything changes or gets worse. Alright, you have a good rest of your day. Bye-bye now.